Autoimmune disease. Can you successfully manage these conditions with a supervised water fast and a healthy diet? Hello everybody, this is Dr. Asa Fry with Clínica Back to the Garden PR, located in beautiful San Juan, Puerto Rico, La Isla del Encanto. If you have not met us before, we are a residential health and education center specializing in supervised water-only fasting. There are only 2 other centers in the United States, and we're the only center in Latin America to specialize in this sort of modality. Today we're going to speak about autoimmune disease. If you have an autoimmune condition yourself, or if you know someone who has an autoimmune condition, this would be the time to share this. We do these educational videos for free because we desire for ourselves the same thing we desire for everyone else, which is vibrant, abundant health and happiness. Autoimmune conditions include rheumatoid arthritis, ulcerative colitis, type 1 diabetes, lupus, Hashimoto's thyroiditis, scleroderma, Sjogren's disease, psoriasis, ankylosing spondylitis, multiple sclerosis, celiac, Crohn's disease, interstitial cystitis. There are hundreds of autoimmune conditions. With the standard pharmaceutical management, these conditions tend to respond very well symptomatically, short term. However, the long-term prognosis is really not very good. We work with patients who have been diagnosed with autoimmune conditions on a consistent basis, and we do get to see them succeed. In many cases, symptoms disappear completely and the patient can eliminate all need for any dangerous medications. These good things happen because the cause of the problem is being addressed. Our patient Mariana has given us permission to discuss her case today. She was diagnosed with Wegener's granulomatosis, or granulomatosis with polyangiitis. This is a condition where the tissues and arteries of the respiratory tract become inflamed and restrict blood flow to the tissues inside the airways, leading to the inability to breathe. Damage to the lungs and kidneys can be fatal. These patients require long-term immunosuppressive drugs. The problem is the drugs do not solve the issue. In fact, they complicate matters. Mariana was prescribed albuterol, prednisone, methotrexate, which is a chemotherapy medication, and Arava, which weakens the immune system. Her condition continued to worsen, and it got so bad that she had to have tracheal dilation procedures, 4 of them in total, to physically open the airways. The doctors told her, of course, that she would never improve. After many years, she comes to visit Clínica Back to the Garden. We do a full workup, a detailed history, a physical examination. We also take the appropriate laboratory tests. She turns out to be a great candidate for a water fast. We prepare her for a fast for 1 to 2 months with proper diet. She is able to eliminate all medications, and then she does a 19-day supervised water fast at our residential center. After her fast, she begins to eat a specific diet, and then we instruct her on what exactly she needs to do to maintain these results over a long period of time through the rest of her life. She has not taken any medication since. She looks great. She feels great. Here we're going to be looking at some photos of Mariana from before her stay here at Back to the Garden, and we're going to be following her through. This is a photo of June 19th, 2014, when all these symptoms began. And we move on to her first dilation. This is September 1st, 2015. Her second dilation right here. This is dated April 2nd, 2016. This photo is just after her third dilation. This is October 9th, 2016. Mariana works outdoors, is a really incredible environmentalist, loves the environment and animals, will do anything to protect it. And of course, she never stopped hiking. This is July 14th, 2017, just before her 4th and final dilation. And here is a few months later, just after she came to visit us, and we began to put her on a program that involved a healthy diet and a lot of changes to her lifestyle. This says plant-based diet, no meds, as you can read there. Actually, she's not on a plant-based diet. She's on what we would consider a whole foods, exclusively plant diet without any processed foods. That would be SOS-free. That's sugar, oil, salt, and flour-free. So she's eating an abundance of fruits and vegetables and whole plant products with no animal foods. This is a photo of Mariana when she first began fasting. This is October 30th, 2017. And this is November 23rd, 2017, when Mariana finished her fast. And of course, a picture with us. And a few weeks later, I suppose, or maybe a month later, Mariana looking great and feeling great, back to her normal life again after many years of suffering. When we talk about chronic disease reversal, this is what we are talking about. This patient goes from severe on steroids, on cancer medications, having life-sustaining procedures like tracheal dilations to manage her symptoms and attacks, to eliminating all medications, being able to live a very normal life and eliminating almost all symptoms. There is a reason that we do not use the word cure, implying that the condition itself has vanished with some magic potion or treatment. No, we use the word reverse, meaning opposite or contrary in position or direction. Meaning that, having addressed the cause of the problem, the disease process has effectively been reversed. Through a period of time she was under our care, her health began to improve faster than it was deteriorating. She has literally just begun this process of healing from this condition, and it is a process, and processes do take time. If she doesn't do the right things after her fast, eat a proper diet, get enough sleep, etc., it is likely that symptoms of this condition will return. If she does the right things, there is no reason why she cannot continue to improve. Many cases do require more than one fast in order to get out from under a serious, severe disease or conditions such as diabetes, high blood pressure, rheumatoid arthritis. First of all, what is an autoimmune condition? This is a specific category of diseases where the body has become so confused, the immune system begins to react against the body's own tissues. Depending on what type of tissue is attacked, we get various different diseases. Skin, psoriasis, or eczema, joints, rheumatoid arthritis, connective tissue, scleroderma, glands, Sjogren's syndrome, gastrointestinal system, ulcerative colitis, celiacs or Crohn's disease, the thyroid, Hashimoto's leading to hypothyroidism or Graves' disease. Many different tissues can be involved, such as we see with systemic lupus. Risk factors include genetics. Certain genes can make you more predisposed to develop an autoimmune condition. However, environment trumps genes. Diet, sun exposure, geographic location, tobacco use, chemical exposure. For example, consuming cow's milk does raise your risk significantly for multiple sclerosis and type 1 diabetes. Decreased fiber intake and increased meat and added fat intake, we're talking about oil, butter, lard, this type of intake can raise your risk for other autoimmune conditions. Immune system stimulation. Anything which strongly activates an immune system reaction can lead to the development of an autoimmune condition. Bacterial infections, viral infections, as well as vaccines, which are specifically made to hyperactivate, sometimes violently, the immune system. Intestinal microbiome, or gut. Now we know that the gut barrier can break down over time due to medications, poor diet, stress. With an unhealthy gut barrier, or intestinal endothelium, undigested protein particles can be absorbed into the bloodstream, and often these are seen as foreign. So the body will begin an immune reaction to these particles and also search and destroy other particles which appear to be the same, even though these particles might be our very own tissues. This is called molecular mimicry. Now, why does fasting work? Most importantly, the total number of white blood cells lowers significantly, and the hematopoietic stem cells in the bone marrow are activated. So you are essentially creating an environment where the immune system virtually regenerates itself. It's almost as if the immune system were like a soccer team. Now, in soccer, you only get 3 substitutes. You have 11 players on the field, and you can substitute 3 of them during the course of the game. But what would happen if you could substitute virtually the entire team? So your team is playing with 11 players, and they begin to get tired or injured, or maybe they grow old, or maybe they're just playing badly. Sometimes they're even scoring against you, which is exactly what an autoimmune reaction is. So while fasting, you can warm up 11 new players and virtually substitute the entire team, especially getting rid of players who are playing for the other team, autoimmune white blood cells. So you can go from this team, a team of older, fatter, extremely tired, really out of shape men, to this team, a world-class team, the German national team who won the World Cup in 2016. Number 2, inflammation and oxidation decrease during a fast on a systemic level. All inflamed tissues and fluids are able to calm down and come back to a set point. Joints, muscles, connective tissue, tendons, edema, swelling improves. The blood pressure can normalize, as well as blood sugar levels, and insulin resistance improves. Number 3, the intestines actually get a chance to rest and heal, probably for the first time in your entire life. The microbiome can normalize, as well as intestinal permeability can improve. I must stress, it is important to be monitored during this process if you are fasting any longer than a few days. At our residential center, we monitor fasts up to 40 days. An average fast is around 2 weeks. We have many interviews with patients who have improved their autoimmune conditions. If you would like to see these, go to our Facebook videos, YouTube channel, as well as backtothegardenpr.com. Delamar here is another example of a patient who has had some great success with water fasting and a healthy diet and lifestyle. She was diagnosed with Sjogren's syndrome. Symptoms began shortly after having numerous doses of a specific vaccination. Doctors told her she would continue to worsen. Severe pain in the joints and muscles, fatigue. She had intestinal problems as well. With a short fast and the introduction of a healthy diet, exclusively made of plants with no processed foods such as oil, salt, flour, or sugar, now she's able to live a normal life with no medications, and her condition continues to improve as long as she does the right things in terms of diet, lifestyle, and an occasional fast. Dr. Joanna and myself will be speaking at the National Health Association Conference in Cleveland, Ohio. This year it is from July 29th to July 1st. If you would like to know more about this conference and quite possibly attend, please visit healthscience.org. The National Health Association Conference is a conference where doctors like us, really masters in practicing healthful lifestyle principles, get together and they educate the public. Many of our idols are speaking during this: Dr. Joel Furman, Dr. Anthony Lim, Dr. Alan Goldhammer, as well as Dr. Frank Sabatino and Dr. Gracie Yuen, as well as many other great speakers. Again, if you'd like to know more, visit healthscience.org. If you want to know more about the process of supervised water-only fasting, please see my previous videos on Facebook, YouTube, as well as backtothegardenpr.com.